are you? Can you hear me now? I think I got
Yes,
it.
we hear you fine. You know what, Dr. Gamboa, I'm going to tell you something. We do about 30 shows a month. People love you.
Oh,
They
thank you.
love how you explain to them. Um, and it's amazing how this show has grown. We're so blessed to have you. I really want to talk about your practice today. And I want to start off, tell people about your background and about your practice.
Sure. Thank you for having me. And also, I am blessed to have this platform to educate people. And I'm glad more and more people are learning about their health and trying to do more proactive and prevention so that they don't have any problems later on or chronic diseases. So my background is family medicine, and later I decided to like improve like on that prevention. So like I did more weight loss and also hormone replacement. I do wellness, more like a functional medicine part. And remember, functional medicine means that we try to find the root of the problem and try to treat the whole person as a whole. And we not only treat the symptoms, so we are like always looking for the reason. Why are you having this symptom? Where is this coming from? What is the what is causing it? So we try to do our best on that.
You know, a lot of people are asking now, do you consider holistic as part of your practice?
I think like we have some of that. I'm not full on that because I have like I would say I'm a hybrid because I was like trained with the traditional medicine, but also I like to do wellness. As I mentioned, I really enjoy doing a lot of prevention and trying my best to find what is the cause of this patient's symptoms and try to go there to help them out.
They also want to know about functional medicine, which you do practice. What is functional medicine?
So as I was mentioning before, like I heard you correctly, there was a little cut off. Is that functional medicine? As I mentioned, we try to treat the patient, the whole patient, and not only looking a piece of the patient, right? Or like a symptom. So a lot of patients, if they come with, let's say, just to give you an example, irregular periods, I'm just quick to put them on birth control so that they have regular periods. But I'm like, hey, why are you having the irregular periods? Are you having a metabolic dysfunction? Are you having, now it's called PMOS? Are you having any thyroid issues? Are you having any other problems that are causing you to have irregular periods? So that's one little example of what functional medicine do, or wellness people, that we try to find what is the root of the problem.
Um, this is from Mary Ann. She's in Fort Worth. She wants to know, do you treat gout? And if so, how do you treat it? Did you hear that, Dr. Gamboa?
I'm sorry. No, I'm
Did you?
sorry, Steve. Like, can you repeat that, please?
No problem. So someone wants to know uh, if you treat gout, and if so, how do you treat it?
Oh no, like I'm not hearing you. I'm sorry.
Okay. Can you hear me now? Let's see. Let me
Clearly,
try
Steve.
something here.
No, Steve, it's not you. Kimbo is having internet intermittence. I can hear you clearly.
Okay.
Can you hear me now? Like I don't know what happened. It froze for a minute.
Can you hear me now? Hello?
Yes, I can hear you now.
Okay. So, and if not, I
Yes, I
can
can
write
hear
it.
you.
Okay. So someone just wrote in, do you treat gout? If so, how do you treat it? Oh, no.
Yes, like I mean, gout can be a problem from even the medications you're taking, because some diuretics that we normally give for blood pressure, they can cause you gout. So So that's what I mean, that we have to look for the root of the problem. So gout also could be because of accumulation of your uric acid. Either you could be eating too much like animal protein, like that you're having that red meat or even like any kind of animal protein. And or you can be one of those people that, so there could be like many things. If you're having a gout attack, you need to have anti-inflammatories. And depending on how your kidney function is, then we have to see if we give you the regular anti-inflammatories like the and naproxen or any of those non-steroidal anti-inflammatories, or we can give you steroids if you're having like kidney issues and you cannot take those, or we go to the good old colchicine that it's great for treating gout.
Here's Ronald and Garland. I love your show. I don't miss one of them. I'm so glad you do it the same time every month. What causes ankles to swell up?
Thank you. What was the question, Steve? I'm sorry. Do you want to type it in the chat? I think today, I don't know what's going on with the
I'm going to
internet.
see. I'm going to put this in the chat. They want to know what causes ankles to swell up.
That's a very good and interesting question, because it could be several things. It could be gout, uric acid. It could be osteoarthritis, like that your ankles are like the joint in your ankle is kind of like wearing out, similar to your knees. It could be that you're having, if like you also have something called psoriatic arthritis, that's like also like a joint issue, or rheumatoid arthritis. But if it's only the ankles, you also have to look into the medications you're taking, because some medications for the blood pressure can give you some swelling in your legs, and those ones do not respond to diuretics. Or it could be that your veins are not working as they should, and you need just to wear some compression socks. Also, if you continue to have that, you have to think about, is it coming from my heart? Is my heart not pumping enough fluids? Or is it your kidneys that are not eliminating enough fluids? So you have to look at where this swelling is coming from, not just give you, oh, take this diuretic and do this. But we have to look at what's going on for that swelling.
Okay. Next question is, I hear so many negative things about new weight loss injection. What is true and what isn't?
Oh, thank you for bringing this up. I think a lot has to do with misinformation, and also like some people, unfortunately, they will have or develop some serious adverse effects, or adverse effects that they were caused by them not taking the right dose, because whoever was giving them the injections did not have the training to do so, or they were still taking the medication in spite of having some adverse effects. So I would say that the weight loss injections are great for those people that they need them, and also great for anyone that is having like this chronic disease called obesity. So it helps. It has a lot of benefits, because if you lose 50, 70 pounds, then you may not snore as you used to, and then your sleep apnea improves. Your diabetes can go into remission. You may not need any more like blood pressure medication. So the medications are great whenever they're done correctly. And like again, like these medications are not for everyone. You may be very sensitive to the injections, and you may develop severe adverse effects. And unfortunately, we have to look for other tools in our toolbox to help you with the weight loss. But for the most part, the injections are very well tolerated. They have really good benefits. Some of them, they decrease the risks for heart attacks, strokes. They also help you decrease the risk for you or for the diabetics developing chronic kidney disease. Nowadays, the newer indication for one of those medications is that it helps with the fatty liver. So like early studies have shown that those injections are going to decrease the amount of fibrosis from the liver. So those are very promising things. Before, we didn't have any medication to help with the fatty liver. The only treatment was weight loss. But now we have something that also helps with other things to help us with that.
I just read the other day that these injections might get people off of alcoholism.
Like that's an excellent point, Steve. So because the way these medications work, and we are still learning about this, because yes, we know they turn on some like receptors in our gut, but we don't know yet how much is the benefits or the effect in our brain. Yes, we know that it decreases the cravings. A lot of my patients, if they were like drinking some wine on Fridays or so, the injections, they don't feel like doing that. So they decrease those cravings. So now they're looking into these medications, into possibility of for the alcohol, maybe even addiction for other substances. So it's very promising, and we're looking into that.
Okay, let me give you the next question. It's about pellets.
Oh, thank you for bringing that up. Yes, like so the question is, I heard pellets give you more energy. Can female have that procedure? Absolutely. But also the pellets, similar to the injections, not one, have to be very careful about the dosing. So pellets is not something that we can just give you a whole amount of like hormones. We always have to be conservative. We always have to like balance your hormones and try to imitate what your ovaries were doing. Unfortunately, there's nothing humanly made yet that they can do that. And the closest thing is the pellets, because that's going to be a steady amount of hormones given to you. But again, we have to check your hormones. We have to see how you respond. We have to make sure that we are not causing any problems, and that we are like helping you with the hormones. But absolutely, they will give you energy. Like you're going to be like thinking more clearly. You're going to sleep better. So the pellets done the right way, they help tremendously.
How often do you have to have it redone?
So it's like also depends on every patient. So for example, like for men, like usually it's every 5 months, 6 months. It depends on the age also. The older the guys are, the less they're metabolizing the testosterone, so it can last a little longer. Also, if you're not as active physically, that's another reason why you can have the pellets last a little longer for you. For women is a little different. For women, we can do like every 3 months. If you're also like very active, like physically, then maybe a little bit less than 3 months, maybe like 11 or 10 weeks. But if you are older also, like then again, it metabolizes slower, then we can go ahead and do every 4 months. So it depends on everyone. Everyone it's such a, this is the wonder of medicine. It's not a cookie cutter thing. So everyone is different, and we have to find what is best for each one of them.
Here's a diabetic question for you, Dr. Gamboa.
Okay, so yes, like, and in this country especially, we have to be very careful about the hidden sugars that we find in the food. So we have to be very careful, because sometimes we are drinking a lot of sodas, and that's tons of sugar, and we don't realize that. So how do I check diabetes? So for the diabetes, there are several things. We can check for your sugar whenever you're fasting. That's like one type of like test. And then if like that is greater than 100 consistently, or 120, then probably you have some either pre-diabetes or your like early diabetes on you. Another one is the hemoglobin A1C. The hemoglobin A1C is a test in your blood that checks for the sugar the last 3 months. So this one gives you an average, or how much your sugar has been, and it comes in percentage. So whenever it's less than 5.7, then you should be fine. If it's 5.7 or greater, then you're in the pre-diabetes range. And if it becomes higher than 6.5, then you're in the diabetes range. And if it becomes higher than 6.5, then you're in the pre-diabetes range. And if it becomes higher than 6.7, then you're in the pre-diabetes range. And if it becomes higher than 6.8, then you're in the diabetes range. And if it becomes higher than 6.9, then you're in the pre-diabetes range. And if it becomes higher than 6.9, then you're in the pre-diabetes range. And if it becomes higher than 6.10, then you're in the diabetes range. And if it becomes higher than 6.11, then you're in the pre-diabetes range. And if it becomes higher than 6.12, then you're in the pre-diabetes range. And if it becomes higher than 6.13, then you're in the pre-diabetes range. And if it becomes higher than 6.14, then you're in the pre-diabetes range. And if it becomes higher than 6.15, then you're in the pre-diabetes range. And if it becomes higher than 6.16, then you're in That's whenever you have the diagnosis of diabetes. Also, with carbs, try to consume more complex carbs like quinoa, like sweet potato, whole grains. Try to do that instead of just the refined white bread or the regular potato.
Here comes the next question. It's about supplements and weight loss.
So, which supplements work when it comes to losing weight? So, that's an excellent question. So, there's a lot of people also that they are like a little like concerned about the possible side effects, or they don't want to be on any prescribed medication. So, we can go to the supplements. Supplements also, whenever they are done the right way and we get it from reliable sources, they can be great assets or sources. So, for example, so there's one that is called Calicurb. Calicurb is a supplement that you can find it in Amazon, but that's at the lower side. Now we have the clinical dose of that. So, Calicurb is similar to the effect that the injections do to you, but it's a supplement. So they found this crops in one island in New Zealand, and they extracted from that plant, and they found that this kind of extract of this plant turns on the same receptors that the injections do. It gives you a very milder but similar effects to the injections. Of course, that's like very milder effect. The clinical dose is a little better, and then you can have more effect with that. So that's one option. Other options are to help you with insulin resistance, like berberine. And then also, if you have like PMOS, previously called PCOS, like inositol is another one that helps with all this insulin resistance, helps with that metabolic dysfunction. So if you want, chromium is another supplement that helps with it, excuse me, insulin resistance. So those are like good supplements that I can think of to help us with weight loss.
This is kind of a good way to do this. Here's the next question on vitamin C.
Oh, thank you so much. Yes, so too much vitamin C is not good, because remember, like vitamin C is going to cause acidification. Too much acidification if the urine or like your body is not good either. So try not to overdo it on your vitamin C. So vitamin C is great for your immune system, for the to prevent the too much bruising because of the fragility of your capillaries. Excuse me. And I'm gonna take a little drink. Sorry.
You need a doctor.
Right. I'm drinking only like sprinkled water with like with lime, but so iron. I mean, iron is it's better absorbed with vitamin C. So that's another like good thing for the vitamin C. But don't overdo it. Sometimes we think that the more is better, but with vitamins we always have to be careful. Too much of one vitamin can be toxic. That's the case with vitamin A. Too much vitamin A can be toxic to your liver. Too much iron can be toxic to the liver. So always be careful about vitamins, because it doesn't mean that because like you're taking more vitamins you're healthier. It could be totally the opposite.
She has a follow-up question about Tylenol.
Okay, so like Tylenol, that's an excellent question. So Tylenol can cause a lot of like problems to your liver. So your max is 24 hours. So that's what I want you to not go past that. So that would be four tablets of the 500 milligrams. Now they don't make them as much, but then you can do that. So I don't want you to overdo it with Tylenol either.
Dr. Gamboa, your show goes by so fast.
And you can take it every 6 hours.
And this is a kind of a cool way to do it. Tell people how they can reach your office.
947-6020, and it's Elite Care Clinic.
And your website?
And my website is www.elitecare-clinic.com.
Dr. Gamboa is with us at the last Wednesday of the month at 4:25 Central Time. Dr. Gamboa, we did another one. Thank you so much, Dr. Gamboa.
Thank you, Steve. Thank you so much. And again, like it's wonderful to have this platform to teach and to help people be healthier, because that's what we need in this country. Like, we have to be healthier, and we have to do more like prevention.
Well, wait till you see the numbers. We'll see you next month. That's Dr. Gamboa. Sorry about, this is a live show. Things like this happen. Anyway, I want everybody to keep in prayer to our great producer, Rebel. Her friend is getting ready to have surgery. She's been in my prayers for the last week. And we will see you guys tomorrow at 5 o'clock Eastern Time. We'll see you then.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.